Today is April 24th, 2010. We're in St. Charles, and we're talking one-on-one with Congressman Bill Foster.
Hi.
Good to see you again.
What's on your mind this week?
All right. Hey, on March 10th, Speaker Pelosi said we needed to pass the health care bill to find out what's in it. Do you agree with that legislative philosophy of passing bills without knowing what's in it and then finding out afterwards?
I don't believe so, no.
Okay, I mean, you think that a responsible representative would read all the relevant information and study the different analyses to understand what was going to happen to their constituents before they cast their vote?
In enough detail to know whether the bill was good or bad for their constituents.
Okay, last week when we talked, you said you didn't read the CBO analysis on the spending. You reviewed some of the summaries.
That's right. There were various summaries that were presented.
And so you weren't aware of the fact that you were cutting Medicare fee-for-service payments by $200 billion.
Yeah, that's actually one of the talking points that's not true about it. This is
we went through this last week. Here's the CBO analysis. There's the number, $196 billion cut fee-for-service. Okay. Now, have you seen the CMS report that the Department of Health and Human Services distributed the other day?
I have seen a newspaper write-up on it. I think it was in the Wall Street
funny, I've read it, and I'm just a constituent. I would think you as a congressman would want to know the impact of your vote on your constituents. Let's take a look at what Richard Foster, the chief actuary, said. Would you say he's an expert in the field?
I don't know the man personally. They usually put fairly competent people in charge of this.
Oh, okay. So I think that since this report is being issued by the Department of Health and Human Services, I mean, it must be accurate, right? The government doesn't issue inaccurate documents, I would think. He says that there's $233 billion reduction. That's your vote. You voted to cut Medicare spending, fee-for-services, by $233 billion. Okay?
You have 1 minute.
Did you?
Sir.
Okay. Did you know what the impact of that vote is going to be according to this report? You are going to put 15% of medical providers out of business within the next 10 years. Did you know that when you cast your vote?
I do not believe that will be the case.
Oh, well, I'm sorry. Are you calling him a liar? You're saying his analysis? You haven't read this analysis. How would you know whether that's the case or not?
All of these numbers are uncertain in some degree.
So you're saying that Richard Foster here doesn't know what he's talking about. This is his analysis. Did you know of this analysis? Did you ask for this analysis before the vote?
Yeah. Congress has asked for a series of increasingly accurate costs.
Why didn't you do it before the vote?
Because this is only intermediate of a number of more detailed cost estimates.
No, that's not true. Here it is. This is the impact of your vote on this country. 15% of providers will go out of business. Who's going to provide me my health care? Health care insurance doesn't do any good if I don't have any health care providers, correct?
Sir, your time is up.
All right, very good. Thank you.
But we have to pass the bill so that you can find out what is in it.